Chronic diseases, patients who want to come in, get them treated, preserve their sperms, further treatment. So we have now your sperms for future fertility. Now another example I see, patients coming in and they want to have a vasectomy done. Now let's say you're married to somebody, you have 3 kids, you think you've completed your family, and what happens is you get, okay, I'm done, I'd like to have a vasectomy done. But some of them think, maybe later on, things can happen. If you freeze your sperms around, you can always use them just in case. So we have that group of patients who come in also and just want to freeze their sperms. And what happens is this blood flow does not go back to the body very well. And then what happens is these blood vessels dilate and they cause an increased heat around the testis. And that heat starts to destroy the testis. So sperm quality actually comes down. Now when this sperm quality is coming downwards, what we notice before it gets any worse, we tell patients to preserve your sperms first. Varicocele, most of the time, are asymptomatic, hardly any symptoms. But some individuals, what they do is they actually come with this dragging sensation, dragging pain, as if someone is, or they may come with where they can have, they notice that there's a swelling in that side of the scrotum, and they realize the thing they feel like, I've got this area, it feels like a bag of worms. And that's a classic thing they tell you, because it feels like that, it's a bunch of worms. And these are all blood vessels that are dilated. This by itself can cause fertility. And I believe, for me, right now there's more awareness of it, and patients are actually coming forward getting treated. I've had quite a few patients who have come with almost no sperms, and after fertility treatment, after varicocelectomy or varicocele surgery, have almost improved. In fact, now we do the surgeries laparoscopically with just tiny little incisions, and they do very well.
It is definitely more than 10 years. So this entire TMC, the history is starting since 1994. So yeah, I think after about 5 years into operation, we start to look into this program. The demand is low. The supply is also low. Initially, it's like that. Then slowly throughout the years, you have more and more people start to request for it. Then we start to go out and look for more people to supply for our sperm bank. Then it slowly goes up from there. Mostly, it's actually through friends.
Oh, through friends, or your the nurses' friends.
Yes, colleagues and then friends. So they ask around. We have this needs. Anybody that's interested.
Okay.
Something very the way public understand it, especially during the initial years, it is very different. Most of them would thought that sperm donation is direct donation. There is a lot of explanation that we need to do. We start with like about 2-3 donors in our list, and now we are having more than 65. Not exactly. So usually what we will do is, first of all, we want them to be healthy. So you shouldn't be a smoker, or alcoholic, that kind of thing. And then afterwards, what we'll look at later is actually their qualifications, like educational level,